Hello, I'm Dr. Helen Pinsanti, and welcome to Doctor, where medical conversation meets everyday understanding for you and your health. Today, we're going to be talking about Restless Legs Syndrome, or RLS. If you've ever been in bed and your leg suddenly flips up your sheets and your blankets, well, we're going to explain why it happens, who gets it, how to diagnose it, and the best way to get relief. So joining me today is Dr. Bryn Henderson, a board-certified physician and medical innovator with years of experience in patient care and advancing new approaches in medicine. So, Doctor, what is RLS in plain words?
Well, thank you. RLS is a condition where people feel a strong involuntary urge to move their legs, often with uncomfortable feelings like crawling, tingling, or pulling. It shows up when you're resting, sitting, or lying down, and usually gets worse at night. Moving the legs gives short-term relief. Because it strikes in the evening, it often ruins sleep, causing daytime tiredness and low mood. RLS is common, long-lasting for many, and can greatly impact and affect the quality of your life.
How many people are actually affected by it?
Approximately 5 to 10% of adults have RLS, and it's more common in women than men, and it tends to increase in age. Some people have it in their families and notice symptoms early in life. Others develop later because health issues like low iron, kidney disease, pregnancy, or nerve problems.
Many patients say, I can't get to sleep. My legs are always flipping around at night. If that's the case, and they've come to a physician, what are the clues that they actually have restless leg syndrome and not something else?
Well, the key clues are a strong tendency to move the legs involuntarily. Symptoms start to get worse when resting. Moving helps, at least for a while, and nights are usually worse. Unlike a sudden cramp in a muscle, RLS sensations are more like crawling or tingling that push you to move. It's not the same as joint pain from arthritis. Doctors also make sure it's not something else like leg cramps or certain nerve problems.
All right, so now they have this need to move.
It's involuntary. Sometimes they can't even stop it. The brain's dopamine system controls movement. It sure doesn't work smooth if you have restless leg syndrome. The brain could also be low on other things. It could be low on iron, which is needed to make the dopamine. And there's some people, overexcited nerve circuits, make their legs feel like it's jumpy. And last but not least, the RLS follows a body clock pattern, which is why evenings are tougher, and genes could also play a role.
You mentioned the word dopamine. What about people that have Parkinson's?
Good point. Parkinson's is a lack of dopamine created in the substantia nigra centrally. And so when they have a lack of dopamine and it causes the rigidity and other things in Parkinson's, they're very susceptible to restless leg syndrome.
All right, so we've talked about low iron, kidney disease, diabetes with nerve damage, but what about some other drugs?
Well, there's no question what you state's true, but some medications, especially certain antidepressants, or medications that block dopamine can trigger or worsen RLS. Stress, caffeine's a big one, nicotine and alcohol are two of the other commons, and of course, poor sleep habits make the symptoms flare. So treating the trigger, like fixing low iron, can really help.
All right, what does a typical workup look like in your office?
In our office, we have principally 4 major clues. We mentioned those, that we check the blood for iron, especially ferritin. And we also do a brain map. It's real easy. You just put it on your head. In our practice, we also use a thermogram. It's a non-invasive methodology to determine blood perfusion in the extremities. And we can look at circulation in the legs as well. That helps us rule out a blood flow problem that may worsen nighttime leg discomfort. Thermography does not diagnose RLS by itself, but it adds this information about the circulation while we confirm RLS using standard symptom criteria and iron testing.
All right. What should one do for self-care of this pathology, would you call it?
This disease process, without a doubt, benefited from a steady sleep schedule. Make your room cool and often dark. Avoid screens an hour before bed. Stretch your legs and take a warm shower. Try gentle massages before sleep. Stay active during the day, but skip the hard workouts right before bed. Cut back on the caffeine, alcohol, and nicotine if at all possible. Drink more water and eat iron-rich foods, leafy greens, beans, and lean meats, plus magnesium-rich foods, nuts, seeds. These basic habits reduce the symptom bursts and improve sleep.
Well, I'm not going to let you get away with not asking this final thing because, as you know, or maybe you don't know, for 20 years I did Sirius XM radio call-in shows, and we would have people call in and say, I have restless leg syndrome, and somebody told me to put a bar of soap under my sheet. And then somebody else said, oh, and they'd call in and say, oh no, drink pickle juice and keep it by your bedside. Have you ever heard of these things, or is this new to you?
And I may have heard, but reality is there's a lot of myths
Yeah.
or old wives' tales
Yeah.
or something that can help us.
Yeah.
Don't get fooled into doing that. Check the ferritin and measure the iron, and if we need to, we can replace it. And oral iron is sometimes constipating, so sometimes they need IVs in tough cases. We also keep an eye on the cause of the low iron, which can be diet or heavy menstrual cycles or GI losses where you have bleeding from the colon. Correcting the iron can calm symptoms and reduce the need for other medicines.
So can people then start, Googling lists of foods high in iron and make sure that they're eating daily
Absolutely.
foods high in iron?
Absolutely.
All right.
There's two main groups that we can help if we're talking about medication.
Yeah.
The alpha delta ligands, the pregabalin, and the dopamine type drugs that are used for treating Parkinson's. The first group is great when pain, anxiety, or poor sleep are also problems. Dopamine drugs can work well, but may cause augmentation or increasing in some of the symptoms, creeping earlier in the day and spreading to more aspects of the leg, especially after long use or high doses. In very stubborn cases, other medications should be considered, but we're careful about dependence on side effects. We always pair meds with lifestyle and iron care.
All right. Let's talk about traditional Chinese medicine. What do they do for restless leg syndrome?
But TCM RLS is seen as an imbalance in energy and blood flow. So they utilize acupuncture and many herbal formulas because that helps reduce the symptoms and improve sleep for some people, with generally good tolerance. These options to consider are in addition to good sleep habits, iron care, and ideally coordinated with your medical team.
How often should the patients come into your office to follow up?
New patients are usually seen every 4 weeks until stable. After that, every month works for many, sooner if symptoms worsen or medications need to be changed. We check iron when needed, watch for augmentation with dopamine type drugs, and keep coaching lifestyle skills. Outlook is very good when you can address the triggers and treat them so that you have habits that are healthy. Some sedentary causes like pregnancy or iron deficiency can improve or resolve. Primary RLS may be long-term, but with the right mix of steps, most people feel and sleep much better.
All right. I don't want to leave those people that do not have restless leg syndrome, but think they do, but it's only muscle cramps. What should they do for the muscle cramps?
The muscle cramp should be done with an evaluation of the massage impact, the exercises that are more along the lines of aerobic, and having positional changes. The gentle stretching and muscle massages are very effective You can even vary the temperature, apply heat or cold, and see how that impacts the muscle spasm.
All right. So, what is your mnemonic for restless leg syndrome?
It's sort of easy. Relaxed legs.
R stands for?
Regular sleep, same bedtime wake cycle in a cool, dark, quiet room.
E.
Easier than routine, stretching and gentle massage.
L.
Lower your caffeine. None after lunch. Skip the nicotine and alcohol at night.
A.
Assess iron levels. Ask for ferritin. Treat low iron as advised.
X.
Extra movement by day, walk, light exercise, and avoid intense workouts late night.
L.
Leg care. Heat, ice is needed. Try a pillow or weighted blanket.
E.
Eat smart, iron and magnesium-rich foods, and hydrate.
G.
Guided meds. If needed, use doctor-guided meds, gabapentin, or dopamine type of drugs, and watch for their side effects.
S.
Schedule follow-ups, track symptoms, sleep, and iron. Adjust the plan as you go.
Wonderful. Well, restless leg syndrome may sound small, but as we've learned today, it can steal sleep, energy, and peace of mind. The good news is there is help. With the right habits, proper testing, and safe treatments, people can control and finally rest easy. And I think for today, you've learned that iron and ferritin are very important in this restless leg scenario. So thank you, Dr. Henderson, for sharing your expertise and giving hope and information to so many who struggle silently at night. Hopefully not anymore. Remember, your legs don't have to keep you running when all you want is a good night's sleep. Talk to your doctor, take action, and give yourself the gift of better sleep. So thank you for being with us. If you would like to see Dr. Bryn Henderson in person, I encourage you to call 714-639-4013. His office is at 615 East Chapman Avenue in Orange, California. That's in Orange County, California. And if you'd like to get in touch with me, go to my website, www.askdrhelen.com. That's www.askdrhelen.com. Until next time, I'm Dr. Helen Pinsanti. This is Doctor to Doctor, where real doctors share innovative information to bring hope to you for your health. Join us next time. Bye for now.